Well, it's hard to believe that we're talking about back to school. Summer seems to have gone awfully fast, but this year is really different. And so that's what we're here to do tonight, is talk about back to school in the era of COVID-19. Hi, I'm Dr. Jim Heise, Chief Medical Officer at Door County Medical Center. I'm joined this evening by our Chief of Pediatrics, Dr. Amy Fogarty. Welcome, Amy.
Thank you.
So our plan for tonight is to, we'll give you some basic information to start, and then we're going to go ahead and do the best we can to answer your questions. This will be about an hour long, so we're looking forward to answering your questions. I guess I'd start out by just commenting that, you know, the school districts have been working tirelessly to get things set up for school this year, and it's been really impressive, the work that they've done. And you know, no matter what decisions they make, they have a tough job. Someone's not going to like the decisions that they make. So tonight we're not going to talk about any one specific district or what one district is doing versus the other. We're going to talk more broadly and hopefully spend most of the time answering your questions about the safety of sending your child back to school. So Dr. Fogarty is the medical advisor for the school districts of Door County. And she's spent a lot of time at the school board meetings and other meetings talking about medical parts of this that we should be thinking about. And what I'd ask her to do tonight is just kind of go through what she's gone through for the school board meetings, because I had the opportunity of seeing one of those, and it was excellent. So Amy, if you would just go ahead and let us kind of give the presentation that you gave at the school board meetings.
Yeah, absolutely. So I think if anything that we've learned in the past few months, especially with the school shutdown between March and the beginning of June, was that schools are of vital importance to our kids and to our community and to our families. Kids learn best when they're in person, and that's not even including all of the other benefits that schools bring to our families and to our kids, if that's with physical health or if that's with mental health and with their learning. So being back in the school building and learning in person is really of the utmost importance. And so everybody has been working very hard, the superintendents and the principals and the Department of Public Health, the school nursing staff, to try and put together a plan where we're going to be able to not just open schools in September, but to be able to try to keep them open in the long term. And when they are open, to keep not just the kids, but also all of the staff members safe. We've come up with 3 major ways that the school districts are trying to concentrate their efforts to try to keep kids safe and staff safe. The first of those is to make sure that anybody that's going into the school building is feeling well. So anybody that's having symptoms, anybody that's not feeling well, should not be in the school building, if that's students or if that's staff. And also trying to streamline ways in which the school nursing staff is able to deal with kids if they get sick, or staff while they're in the school building. The second thing that is obviously very important is, what do you do with the kids and staff while they're in the building? And so making sure that they're masked and that they're socially distanced, if at all possible, is going to be the next thing. And then the last thing is keeping things as clean as reasonable. So making sure that there's good availability of hand sanitizers, making sure that hard surfaces are clean as much as feasible, adjusting things like bathroom breaks and lunches to try and keep areas as clean as what they can, and to limit use of public spaces. And by doing those 3 things, you get kind of a layered effect. So washing your hands all the time won't keep you safe if you're not doing the other things. Wearing a mask all the time won't keep you safe if you're not doing the other things. So it's really about adding those things one on top of another in order to try to get the best effect and to keep kids safe and staff. So that's what the school districts have been working really hard on. Mm-hmm. And each plan looks a little bit different just because of the logistics of the school districts for the most part. They have different numbers of students and families. They have different numbers of buildings. Logistically, things may be different with construction projects, number of entrances, those sorts of things. So they're all taking those things into consideration when they're trying to put the best plan forward. Understanding that those things are going to change, and we make the best plan that we can right now with the information that we have, and know that those plans are going to be adjusted depending on the circumstances.
So what we're going to do, so I encourage you to start typing in your questions if you have any. We only have one so far, and I'm trying to get it to work as I do every week that we're doing this. So here we go. So this is a good, Monica asked, the first question is a good one, and I think it's a good general question that I think a lot of us are thinking about, which is, what about the fact that parents are out working and their kids potentially could be exposed from those parents, and then they come to school? What do we do about that?
Well, and it's what we've all been trying to do. So, and this is everybody working together as a community. So it's not just about the kids wearing masks or being socially distanced. It's about parents doing that. If it's when you're going into Walmart or when you're going into your workplace and doing the best they can to protect themselves, staying at home when you can, making sure they're staying at home when they're sick, so that everybody in the community can be safe. And if we all work together, we're going to be able to be much more successful than any one area. Mm-hmm. If only the schools are wearing masks and doing these things, and you're absolutely right, we won't be effective. It's really about everybody trying to work together.
Yeah, and I think that's going to be one of the things that I have heard. I know Dr. Fogarty has said it, and I've heard it said in at least one school board meeting, which is we really want to stress this year of all years. You've always used the words, if your child is sick, don't send them to school, keep them home. I think this year the importance of that is so much more because, sure, it could be a cold, it could be flu, but you don't know what it is. And so the abundance of caution, I think, is warranted in this case. So keep your kids home if they're not feeling well.
Absolutely.
And there's a lot of gray areas that, I wish we'd be able to give you a better sense of, well, but my child sometimes has allergies and they've got the sniffles. How do I know? And there's no easy answer to that, would you say? I mean, it really is using your best judgment. I mean, I take care of adults, and I used to say when I'd have someone come in and they had respiratory symptoms and they said, but I do get occasional allergies I don't really know. The question I would often ask is, well, do you feel sick? And I think that's a big thing, because if it's allergies, you generally feel okay other than the symptoms of allergies. If it's because of a virus or some kind of a bug, you're going to feel that way. You're going to feel run down.
Well, and especially paying attention to those more specific symptoms like fever or shortness of breath. Those don't come with allergies. And
Right.
Even if it's a cough or if it's a sore throat that you may sometimes have with allergies, if there's an increasing severity of that symptom beyond what's typical, those are things to pay attention to and to really take seriously, so that we can, again, the idea is to try and keep schools open, and when we all work together, that's how we're going to get there.
So I know a person commented, which I'm not sure if this is true or not. Paul says that he heard today that the CDC says that children can carry 10 times the infection rate than adults. I'm not sure I understand what that means. Any idea?
I'm not.
Okay.
The data for kids, and I'm not sure if he's referring to the number of viral particles or if they can transmit a different number of viral particles. I guess those would be the things in terms of the infection. I'm not sure. I'm not sure what that reference is.
Let's see. Here someone said, I saw today that they stopped taking temperatures at the medical center. My questions are not behaving tonight, so that's, if you wonder why I'm staring at the screen blindly, that's why. I saw today that they'd stopped taking temperatures of those who enter into the medical center. Will they continue the temperature check in schools for the long term or just doing it after a while? I'll make a comment about that and then I'll turn it over to Dr. Fogarty. We stopped doing it at the medical center because we recognized that in many cases, people that were coming in were being seen by their clinician, and a temperature to be taken in that context. Also, when this whole thing started and we were taking it, the temperature readings couldn't necessarily be, I don't want to say believed, but in the end, whenever you take a reading of any kind, a vital sign, a blood pressure, temperature, you want to know, what question am I answering with that result, and what am I going to do with it once I have it? And we came to the conclusion that it really wasn't changing what we were going to do. People were coming in to be seen by their clinician or be seen by the emergency department, so we stopped doing it. But as far as the schools checking temps, I don't remember if they said they were going to be doing that.
That varies by district in terms of the plans. I know that some of them are talking about doing that right now, and others are thinking about trying to work through the logistics of that. The idea would be if your child came to school with a temperature, that then they wouldn't enter the building, which would be effective. The downside to that is, what staff member do you have that's going to be in contact with those kids? How do you deal with the kid that does have a temperature? The need for, one of the things we did find, you end up with a little bit of a bottleneck, right? So if you're unloading 5 school buses and all those buses have to have kids that, a large number of kids that need their temperatures taken, then you're putting those kids within close proximity of one another, which is one of the big things that we're trying to avoid. And typically in unstructured time, particularly younger kids are going to be, they're not going to stay on their spot 6 feet apart. And those are the times when they tend to be interacting a little bit more with one another. And so weighing what benefit you're going to have against the risk, and again, this is another situation in which parents can be really, really helpful and really effective with the schools, is if they're following the guidelines to not send your kid to school when they're sick, there really shouldn't be any kids that are coming in with temperatures, and so the yield may be low. So I'm not sure what the long-term plan is for the schools, if they're going to choose to go through that and if they can kind of work through those logistics. And they may be doing it just to see, what kind of information they're getting. And if after, 2 or 3 weeks, they're finding that parents really are keeping their kids home, they're not finding a lot, then that may be a reason to stop doing the temperature checks at that point.
All right. And if you're wondering why I'm staring at my iPad, I'm looking through questions. Amanda asked a question which I think Dr. Fogarty just addressed. Do you know if the schools have plans for screening? Because unfortunately there are times where parents will send kids to school even though they're sick. And that's obviously been a big topic of conversation. And I do think, I think one of the pieces to that is if a child comes in and is sick or has symptoms of being sick, they're going to, and I'm not going to address specific how they're going to do this, but in general, they're going to be sent home. So the idea is sooner or later people are going to learn pretty quickly. I think that's we just need to keep sick kids out of the schools.
Yeah. This is one that all of the school districts are extremely serious about, because we know we don't want sick kids in the building, and that's going to be your biggest risk. And so all of the schools are really taking very seriously their policies and procedures for sending kids home if they either come to school with symptoms or if they develop them at school.
Let's see. Julie has asked, what's our recommendation with returning to school now that masks are mandatory until the end of September? If I interpret that correctly, it doesn't change what Dr. Fogarty has already said. I mean, our recommendation is that I think it's appropriate for children to go back to school. They do, in many cases, have options for virtual learning if parents feel as though that's the route they'd like to go. In many ways, that takes some of the pressure off of some folks. I'll just speak personally. My son, who is a teenager, was concerned because obviously he unfortunately has to live with the doctor, and we talk about masking all the time and what that means. And he was concerned that initially when it wasn't clear if masking was going to be required or not, he was concerned that he said, you're going to have me wear a mask, I'm going to get picked on. And so he was really apprehensive about that. And that's very real, so I'm sure I'm not the only one, which is why I tell the story. So I think it's actually helpful that the mask mandate has come forth because it just shows that it is important. I mean, and I guess I do want to throw out there, a lot of people have spent time, and I've spent a lot of time addressing questions about, well, is masking really effective? Does it really help? I had someone that said to me, and you're probably seeing it now, your glasses are fogging up. So how can you say that this is protecting anything when your air is clearly coming out of the mask? And the answer again is nothing is perfect in medicine. This is the best we have right now, and it's more of a barrier. So when I'm talking, if I tend to spit actively when I talk, I don't want that spit to go anywhere onto someone else. I want to keep that to myself. That's the reason for masks.
And I think one thing I was going to add is, every family has a slightly different situation. And so I do appreciate that there are definitely circumstances in which families may choose for the virtual option. And then it's good to have the in-person option because families come from very different places, and they have to kind of get to that decision on their own.
Yeah.
And that's a good discussion to have within the family, and if there's significant health concerns, to have that discussion with their child's provider. To be honest, there are relatively few circumstances in which the risk of going to school with appropriate precautions would outweigh the benefit for most of those children. They are there, but for the vast majority, if it's just a child at risk, there's very few of those situations.
I'm seeing some commonalities in questions. One is, we're being asked if there is if I don't want to send my child to school without a mask, or with a mask rather, is a face shield a good alternative?
And I think we've kind of come down to no on that. So it really is, and mostly that's because of, again, where the air is flowing.
Yeah.
You really want to be up nice and close to the face to limit any spread of those droplets as much as you can up close. Yeah. So a face shield would not be considered to be a facial covering.
Right, and that's what's been sort of our my answer when I get asked that question, which is a lot right along, is it certainly is. If you were going to choose, this is not school, this is in general, if you were going to choose to wear a face shield over nothing, a face shield is probably better. The schools, though, it sounds like many of them have chosen to require masks, and now with the governor's decree today, it's sort of a moot point that masks are required for anyone above age 5.
And a face shield would be in addition to a mask.
In addition to.
So you will see sometimes healthcare providers that will have a face shield on, and
Right.
that's to protect their eyes in addition to their nose and mouth.
Right.
So it's an in addition to, not an instead of.
And I did see a question here, which I've seen a couple. Do we know if truancy will be waived this year? That's obviously been a discussion point. I don't know that it's waived per se,
Right.
but you can speak to that more than I
The
can.
guidelines from so in Wisconsin, it's not a matter of a principal or a superintendent, or even from the state superintendent to be able to waive that. So it's actually a legislative issue. In the Department of Public Instruction's guidelines, one of the things that was brought up was that reason for absence be notated. So if it's because that child was a close contact of somebody with COVID, and so it was a mandatory quarantine time versus actually having COVID, they've asked, and I'm not sure they know how they're going to deal with it yet. The legislative bodies have to kind of catch up, right? Mm-hmm. So they have to look at what the Wisconsin law is. But that's what's in part of the Department of Public Instruction's school absence recommendations.
Right.
So they're certainly considering it.
Yeah. Here's a good question Mario asks, and I think a lot of people are asking or wondering about this. What happens if a child or teacher tests positive? Will every student in that class have to be quarantined for 14 days? And I think the big piece to remember, again, is the students will be masked. There will be, to some degree, social distancing. Some districts are actually putting up plexiglass. So it's not at all certain that the whole class will be quarantined. That's really a question for public health. Public health is involved in all of those, and so that's what will happen if that comes to pass. Public health will enter in, and they will decide who's appropriate to be quarantined, if anyone. And then once the virus is introduced in the school, how hard will it be to stop the spread? Any comments to that effect?
No, I think overall it is going to depend on how well these measures have been taken into account, right? So you're going to be much, much better off if the students are masked, and if they're maintaining social distancing, and if we're washing surfaces, and if we're not, sharing eating surfaces, and those sorts of things. So, it depends on the degree of contact, how infectious the person was, if they were, and how long they were in the building, of course. But by taking the measures, we know that each of these things decreases the spread. And so the more of them we do on a more regular basis, the better off everyone will be.
Here's a really good question that Sarah is asking, which I think is fair. Would you send your own children to school at this time?
Yes.
Yes, and that is my intention. Here's Scotty makes a comment, and I think this is worth addressing because cloth masks have been found to be almost 0% effective in the only randomized controlled clinical trial. It depends on what you're looking at. I mean, as far as there have been several clinical trials. When people talk about, especially the public likes to say, well, has there been a randomized controlled trial? And that is a really good device for drugs, if you are having a new drug, that sort of thing. You don't need a randomized controlled trial to know that a parachute might help you if you jump out of an airplane. So in this case, what we're talking about is not, we've never talked about the filtering capability of a mask. If we're talking about the ability of any mask, be it this surgical mask or a cloth mask, to filter out, it clearly fails in that regard. That's not what we're talking about. What we're talking about is the aerosolized droplets, and droplets that you can't necessarily see, but they're bigger than just viral particles. And these things are affected by gravity, which is where the 6 feet comes from. So if I talk and I decide to spit at you, or accidentally spit at you, it's going to do this, it's going to follow an arc, and it's going to fall to the ground in front of your feet by gravity. That's what the cloth mask does. So it's not, and again, as I said, there's nothing perfect. I guarantee you when you search things out on the internet, there's a thing called selection bias. And correct me with the other one, you can find any study you want to support what you're looking to state. So I would be the first person. I talked to the county board Tuesday. I said to them in very scientific terms, wearing a mask sucks. And it's no fun to wear a mask. If you have anyone that tells you it's fun to wear a mask, we probably should have a conversation with that person, because it's not. But in this case, it's one of the easy things we can do that will diminish these numbers. I've been saying right along, if we all were to wear masks in public spaces, not at home, not everywhere, these numbers would really dip down. So that's my 2 cents on that. I don't know if you have anything to add.
I would agree wholeheartedly.
What medical conditions would you advise or consider keeping your children at home if they had?
Yeah, it's a good question. The patients, so, and in some ways, these are ongoing conversations. So for example, I've had several conversations with pediatric cardiologists and pulmonologists over specific patients that are in my practice. And I have yet to have a subspecialist say that that child should stay at home. I do have some patients in my practice that I would recommend. So kids that are on ventilators, kids that have tracheostomy tubes, kids that are unable to protect their airway or who are being suctioned on a regular basis. So very, very severe respiratory issues. A patient with well-controlled asthma, for example, that child would, I think, should be in school. If there's issues with the asthma, we need to address the asthma. Mm-hmm. But if we have it under good control, then they should be a good candidate for being in school.
This is a really good question Amanda asks, and I appreciate the question. Can you talk about how parents should start talking about and helping their kids practice masking now? It takes a while to get used to, and teachers are already going to have a lot on their plates. That's a wonderful question.
It is.
So how would you?
I love the question. And for the people that have been in my office probably over about the last 4 to 6 weeks, we talk about it all the time, and I typically congratulate kids on wearing their masks while they're in my office and encourage parents to continue to practice wearing them for short periods of time, supervising them. And it's going to be a lot of reminders at first. Even for doctors, when we started wearing masks a lot, overall, when you have conversations, we would be unaware of how often we would typically go to touch our face, and then we end up touching a mask. And so the kids are going to be in the same place. And so reminding them to not touch their mask, and they will get used to wearing it. I would put it on, have them practice putting it on and off multiple times during the course of the day, gradually lengthening the time or the space that they're in. And they don't have to, it doesn't have to be like, well, we're going to wear it on a trip to Walmart, right? They can wear it when they're walking outside or any of those types of things. So anytime you're getting used to it, it's amazing. Kids are so flexible and they're teachable, and they will learn to do things. They need to be taught and they need to have practice, but this is something that kids can learn how to do. To be terribly honest, just like the doctors have learned how to do it. I was telling this story a couple of weeks ago. I had left the hospital and I was going to get on my bike and go for a ride, and I got on my bike and I made it down to just down the driveway, and I was like, this feels weird. Like I couldn't figure out what was strange. And then I realized I was actually biking with my mask on.
Yeah.
So, and so you do get used to it. And I think all of us that wear them on a regular basis have had the experience where you do just kind of forget that they're there a little bit. And it just does take practice.
Yeah. There was a question, Linda asked if I could answer the question. Apparently someone asked a question about how safe is it for kids to wear masks all day?
Safe.
Yeah.
I mean, with for the most part, right? I mean, there's always going to be somebody with an extenuating circumstance, and there are some. Like I said, there are some of those. One that I had neglected to mention outside of just respiratory things are like sensory or cognitive delays. We certainly don't want them to be a danger to kids, but for the most part, they're not unsafe to wear.
Mm-hmm. Are parochial schools following the same guidelines as public schools?
So from what I know, there's variable response. They will be following the state masking mandate now, which is different. In some ways they're able to do more because they're smaller and their spaces may be a little bit bigger. They may be able to distance more because of the class sizes. But that very much depends on each of the schools.
Scotty asked another question. Is there scientific evidence that shows that long-term mask wearing is safe? I don't know if there's true scientific evidence, but there's a lot of logical pieces of evidence that you can use. For example, in larger hospitals, there are surgeries that take 9, 10, 11 hours. And I'm not aware of there being any case reports of surgeons dropping over dead from having been in surgery all day or passing out. So there is absolutely no, whether there's scientific literature to state it, but it's just from the science of it as far as the ability for carbon dioxide to leave this mask and oxygen to get in this mask. There's no scientific validity or logical validity to state that this does anything other than prevent, again, if I were to cough right now or spit right now, it's going to stop that as a barrier. It is a barrier. It is not a filter. So that's not what we're trying to do. It's a good question, though, and I'm glad you're asking those because and I think in some cases, and here, so Scotty's telling me now, in surgeons, there are studies showing a reduction in cognitive function after long surgeries. So, one of the things I've learned in doing this now for quite a long time is if you're determined that masking is not something you want to do, you're not going to do it. Nothing that I'm going to say or Dr. Fogarty is going to say is going to help that. So we'll just leave it at that. Let's see. Do UV rays kill COVID-19? Yes, they do. As far as, there's a lot of different, I shouldn't say a lot, different businesses I have seen have utilized UV decontamination devices. So that certainly is one possibility. I don't remember, one of the questions that was on here, I don't remember specifically, but they were talking about air exchange and decontaminating the air. I don't remember what, I know I do recall being at a surgeon-based school board meeting and there was discussion about exchanging that air over the course of a certain amount of time.
Yeah, and in terms of, we talk about this at the hospital, so in terms of true, keeping air out, you need a negative pressure room, which logistically you can't do in a school, right? Or very few places because you have to have double doors and you have to be able to generate a negative pressure. In terms of air exchange, you always have to weigh the filtering with the blowing around of the particles, right? So, I think you have to consider that. And again, those sorts of things are extremely expensive to put in terms of infrastructure and logistically. And I think if we're looking at spending money, are we better off doing things like making sure everybody's in a good mask and putting up plastic barriers and those sorts of things, which may be a little bit more effective of a way to spend what would be a limited resource.
Let's see. How often should children change out of their masks? Daily, weekly, monthly?
So that's a really good question. It depends on the type of mask, and part of it depends on the child. So you have to worry a little bit about masks getting wet. We know that that's an issue. I think reasonably, and what I would plan to do, in my house is if my kids are in cloth masks, I would have them wear one a day. Now my kids are older, so I have twin 15-year-olds, a 13-year-old, and an 11-year-old. So they are not of the age group that's going to be getting masks dirty and things. I don't think it's unreasonable for parents to, have an extra in the backpack, those sorts of things. Mm-hmm. A little bit of that will depend on the kid. I think once a day, though, is probably a pretty reasonable place to be.
Yeah, that's my thought as well. Someone had asked, if I'm not getting to your question, it's because the way that this tends to process out, it sometimes is a little difficult. So someone below had said, please answer the question about the school bus driver. So I found that one, and it's a good one too. How do you envision bus drivers will be safe? That's the issue with all of this. Initially when the CDC came out with their guidelines, speaking of touching masks, I keep doing this, coming out with guidelines as far as what schools should do, in an ideal world, they're at least a month or two ago when they came out with that information, desks should be 6 feet apart from each other in every direction. School buses should only have 12 kids in them, things like that. They were things that in an ideal world, this is the way that they'd like the CDC to recommend. Unfortunately, that's really difficult from a logistical perspective. I think anyone that's been in a classroom of late, how many desks do you, or how many kids do you get in a room 6 feet in all directions? Not very many. Same with a school bus. I can't speak to what they're planning on doing. Perhaps you know.
As well, and again, a lot of these questions were answered just in the last couple of hours with the mandatory masking.
Sure.
So by having the kids masked, I'm not sure what different bus companies are going to be starting to do. Each district is in a little bit of a different spot, whether they contract with a private bus company or they're in charge of their employees. I'm sure it will be some measure of keeping masks on, keeping kids seated, having families sit together as opposed to the family of 4 kids getting on the bus and them all scattering. I would imagine that there's going to be some effort at trying to keep kids that are in the same families together. I don't know if they're going to be looking at things like a bus monitor to help the bus driver to make sure that kids are doing things. Those are all things that are being explored. And some of it is going to come into, too, parents that are going to opt out of busing. So parents that had traditionally used busing, but because of one reason or another are much more willing to say, you know what, I would rather not have my kid on the bus, or we're going to make the effort to bus them in. And so I do think that there's going to be lower numbers of kids on the bus just from parents that are working out ways to give rides or get rides to and from school, which will be very helpful.
Yeah. Here's another one where someone says, please answer this question. And these are good, very good questions. Will the children be made to wear these masks during recess? Will there even be recess?
Well, and that's going to depend on the school, and it's going to depend on the school district. It's going to depend on the ages of the kids. So, what logistically kind of outdoor space is there? How many kids do you have at recess at a given time? Those are all things that are going to have to be taken into consideration. Outdoor spaces are obviously much, we know, safer than indoor spaces. So I know that there is discussion about, what can we do in terms of outdoor instructional time, getting kids out in the classroom and getting them spread out a little bit. I think that, within reason, I think recess is fine and smart. But again, there's going to have to be modifications. Will it be 100 kids thrown out on the playground? No. I would guess that it will not be. There may be smaller groups or restrictions within the group. So, for example, the class that's been together all day will have a certain area that they're allowed to play in on that particular day to kind of keep those kids together as opposed to intermingling classes. There's lots of things that are being thought of, and again, this one's going to be on a school-by-school basis as opposed to a district basis because of the logistics of each of the buildings and the space that's available.
Monica asked a really good question. Are masks with some kind of filter better than those without? I make my own masks. What I'll tell you is what knowledge I have gleaned from my wife, who also makes masks, and there is a quality difference. I mean, and again, what we're talking about is barrier, basically. We're talking about a barrier. So anything is better than nothing. If you have the ability, if you make your own mask, if you have the ability to put some kind of a filter in there, that's great. I do know that my wife, who's a quilter, there is a certain kind of material called batik that I guess has the thread count is very, very tight. And that's what she uses. And because of the tight material and the way it's woven, she has the front of the mask and the back of the mask, and they're serged together. That gives you sort of the layers. And so that, in my estimation anyway, will be a better option than just a t-shirt material, one layer with some loops on it. But again, from a barrier perspective, I don't think anyone is going to start saying you must wear a mask made out of this with this inside. I think that's too much to ask for people. So if you have the ability, yes, I think putting a layer in the middle is not a bad idea. It's probably a good idea. But anything is better than nothing. Let's see. If masks get dirty or wet at school, will the school have replacements on hand, or will parents need to have spares? I think every school district is handling that on a.
They are. The state has provided masks. So each of the school districts, as far as I understand, the allotment was 2 per student. So they're white cloth masks, and so those will be at disposal. In terms of how schools are going to manage it, if they're going to keep those there as their extra supply for when kids have masks, and then ask that parents send their kids in masks, versus that's the expectation that's going to be district by district, I would assume.
RIA comments on St. John Bosco per a letter a month ago. The talk there is 5 masks in a plastic bag, and then they would wear 1 a day, and they'd have something to change into and would wash at the end of the week. That makes sense to me.
Yep.
I think that's
and that's back to the kind of 1 a day
right.
mask and those sorts of things.
Makes a lot of sense. Sevastopol, Benita says Sevastopol ordered 2 masks per student. Why is there not a standard for masks being put out? Cassie, I think it's a good question. I think right now, I don't know the answer. My supposition is, I think what we're talking about again is a barrier. I think something is better than nothing. So I think it's hard enough to get people to acknowledge and accept that masking might be helpful. And I say might be, only because I like to try and address or at least accept the fact that nothing is perfect in medicine. So neither Dr. Fogarty or I are sitting here right now saying that masking is the perfect solution. It's not. But let's face it, we've had this new virus that none of us have seen in our lifetimes for about 7 months now. We're still trying to get on top of this. And so that's the best we can do. So I think if we were to then say, yes, you need a mask, and oh, by the way, it has to be 4 layers of this material with this, I think that would be way too onerous, and that would be too difficult to mandate. So I think that's why there's been no particular standard put out.
Well, and we even saw that when we went through with even mandatory masking at the hospital, where there was a period of time where we were getting cloth masks and those bins would be emptied very quickly. And right. So in terms of availability, I think you need to, everybody's doing the best that they can, and everybody has slightly different resource availability. So I think that's where that's coming from.
Christine asks, seasonal allergies versus COVID symptoms. How will this be addressed?
Yeah, I think we tried to address that at the beginning in terms of a change from baseline is going to be one of those things, and then looking for other symptoms that would obviously not go along with allergies. So very specifically pulling out fever or shortness of breath or difficulty breathing. I mean, those are not allergy symptoms, and those would be much more specific for not just COVID, but for an underlying viral process or even a bacterial process that we would be concerned about. And I think very much understanding typical symptoms for you, and everybody knows that. Even when I have children in my office, if there's concern for strep or if there's a headache, is this a typical headache for you? Is this a typical, does this feel like strep, right? Like there's kids that will know those things. Does this just feel like your allergies? And even kids can answer those, and certainly adults can as well.
Yeah, I'll comment too. Sally made a comment earlier on. I'm looking for a question that I'll talk about in a sec. Please note that as you're encouraging children to go back to school at this time, that there are children that are immune compromised and also some family members. That's absolutely true. And that's why I know Dr. Fogarty has said it, and we say it right along, is these are tough times, and some parents are going to have to make individual decisions for what's best for their child and for their family. And I think we're really fortunate that even in a small area as we are, in a rural area, it sounds like all schools, if I understand correctly, all schools will have a virtual option. So that option exists, and that's
public schools,
a good
yeah.
public schools, yes. I'm looking. Someone had said, please answer. I'm looking for it. Can you comment on the can you please answer the question about a recommended process when kids come home from school? I can't find the original question, so I guess I'm going to assume, you can retype it if you'd like, I'm going to assume for the time being that means probably what should kids do? We had that conversation as healthcare workers. Do you go home, do you take off your clothes in the garage and walk into the shower and scour yourself off? I've never done that. But do you have any thoughts or recommendations on that?
I would agree. I think that's where the question is getting, and I've been asked this question in the office. And I don't have, I think a little bit of it is comfort level. And we've experienced that at the hospital. There's some physicians that have been wearing scrubs and they change, either as they're leaving the building or as soon as they come home. I think just being a little bit reasonable. There's some stuff that's been out that you should wash your kid's backpack every day. I mean, I don't know how realistic that's going to be. I think certainly coming home, making sure that we're washing our hands, making sure that the mask that they were wearing is removed appropriately. And then, I don't think a change of clothes is wrong. If that's feasible in a family, I think that's reasonable. I think this is going to be a little bit of personal preference. Again, we know that the biggest risk is this in person as opposed to the surfaces.
Yeah.
And obviously with kids, the big thing is that they get they get things on their hands, and so trying to keep hands clean, and so washing hands, I think, is going to be the next most important thing.
It's going to be huge, and there's a lot of, and you've seen me do it. I keep doing this because for some reason it's dipping down. There's a lot of talk about touching the mask and things like that. So a couple of things I want to point out to that. You can touch this all you want, but again, you're going to wash your hands frequently. That's the key. You can touch this. You're not, this is not Ebola where all of a sudden you literally are dragging infection around the room. You just want to wash your hands though. I also want to point out that when you're taking a mask off, especially if you have one like this that's disposable, the important part of taking it off is this inside part. So when you lay it down, you either lay it down like this or you fold it up and lay it down. You don't want to put this side down. So, and while we're at it, since I have this mask off, let's talk about correct mask wearing. Over the nose, over the mouth, on the chin, like this. This is the way you wear a mask. This only gives you part way, because again, you could sneeze, and again, we're protecting others, we're not protecting ourselves. You could sneeze. This, of course, your chin doesn't have any need to be covered other than as a place to hold the mask. So this is the way to do it. So when we teach our kids, let's teach them the right way, because I see this all the time when I go to the store and go to various drive-throughs, and everyone's doing the best they can, but it's just one of those things that drives you nuts when you see that.
Well, and back to just to segue with that into the question about getting your kids to wear masks, being okay with letting them try some different ones, right? Mm-hmm. So is the one with the tie in the back better versus the ear loops? There's been a lot of things that people have done at the hospital in terms of headbands or ways that to keep the elastic off the ears if that's causing pain or discomfort. And so finding ones that have for kids with glasses, having a little bit tighter fit around the nose. And working through that and using this time now to try and find some different ones that your child's going to be comfortable in is a good idea.
Alyssa asks, can you address the importance of washing hands versus using hand sanitizer? Either one is equivalent, using hand sanitizer or washing your hands for 20 seconds with soap and water. There's a lot to be said about if you have the opportunity at home, as an example, not so much at school, but at home, there's a lot to be said about a bar of soap. There's very little evidence that shows that anything sits around in that bar. Using a bar of soap that it helps with friction, so using a bar of soap and washing, doing that's actually probably the best way, and then of course the foam soaps. So they're really equivalent.
Well, and certainly the hand sanitizer has the ease of use.
Right.
Most classrooms don't have sinks and soap, and you can certainly hand sanitize multiple times and not have to even get up out of your desk.
Let's see. There's a lot of questions on here about logistics that I think are still to be worked out, at least the specifics, but it's a good question. Amy asks, will kids with symptoms like fever and cough need to be tested before they return to school? I think if there's symptoms at all, testing is going to be important. No symptoms, we're still at that point in time where testing is not an unlimited resource. The people that perform the tests, both the swabbing and running the lab in our laboratories, it's not an unlimited resource, so we can't just open it up for everyone to get tested. But if there are symptoms that seem like they might be, absolutely, I think getting tested makes the most sense. And we're really hopeful that as we get into the early part of the school year, early fall, we'll be able to perform a lot of those tests in-house with a short turnaround time, so it won't be a matter of days. That's our goal. That's what we're working on right now.
And if there's questions at all about whether a test needs to be done, the hospital has really committed to the fact that we're going to keep that COVID hotline open. For those schools that have already sent out registration packets, parents will have gotten this, but with most of them, the hospital actually developed a card that talks about symptoms and then gives our COVID hotline number for both the during business hours and the after hours, and those are really the experts. So they've been trained in how to answer questions and to figure out who should get tested, and they can help decide if there's a question. We would encourage parents to call there to get the right answer.
Well, here's a really good question that Colin asks, because you had answered it so well in the board meeting. If a vaccine becomes available, will it be immediately ready for children, or will that require additional testing?
Yeah, that's a great question. So right now, there are 5 vaccines that are in mass production. So there's multiple vaccines that are in different stages of testing or in production. So what we mean by mass production is even before we've gotten to show efficacy or safety, they're already trying to ramp up production. And the leading pediatric infectious disease doctors and vaccinologists who sit on the FDA and the CDC vaccine advisory boards, they say if one of these vaccines works, we're probably going to be realistically looking at spring of 2022 before they're going to get into mass distribution for kids. And the reason for that is, and the reason that you're seeing the vaccine is going into phase 3 trials, those are kind of the tens of thousands of trial participants. And so it takes a while to get through those. And healthy kids are not going to be the first ones to get the vaccine, right? So if one of these vaccines is proven to be safe and efficacious, and those are 2 really big asks, then what will happen is the highest risk individuals will be getting the vaccine first, which will most likely be elderly people in nursing homes or skilled nursing facilities. And then we're going to kind of roll it back through there. So high risk adults, there's probably going to be testing on healthy adults, perhaps in a controlled population like the military, healthcare workers, and then it's going to get rolled back down onto kids. It's going to be a 2-dose vaccine, most likely. And so you're looking at the logistics of trying to get out, for just the population of the United States, probably 600 million doses. What they're projecting right now is if the vaccine is about 80% efficacious, which is probably pretty conservative. We're probably going to need to get that herd immunity, we need about 70% to be fully vaccinated. So that's 70% of the United States population to have 2 vaccine doses. That's a big number. And that's if everything goes well in terms of production and distribution, which we know that can be difficult. So, and that's why, when we're talking about these school plans, it's not where we were in March, right? So when we were there in March, when decisions were being made, we had a very short period of time to make very big decisions, and it was kind of, what are we going to do for the next? And even initially, when the schools closed, it was not till the end of the school year, right? It was for a week's period of time until the situation could be reevaluated, and then it turned out to be the end of the school year. And these sorts of plans are ones that we have to put in place for. Realistically, probably, for sure this school year and probably next school year as well.
Amy asks or comments that her child sucks on her fingers. She's age 4. Hopefully she'll keep a mask on to school, which she doesn't at daycare. We're talking about age 5 and above, are we not? For masks, at least that's the governor's
That's a state
saying.
mandate. That's the state mandate. If you look at like the American Academy, they'll talk about 2.
Okay, yeah.
So there is that gray period, and there are kids that are certainly younger than 5. I don't think, there's certain kids that are 5 that are in 4K already, and
Sure.
I don't think they're going to distinguish between the 4-year-old
Right.
4Kers
Right.
or the 5-year-old 4Kers. But there are younger kids, and I think in that age group, you're going to do the best that you can, which is what
Right.
everybody's going to be trying
Exactly.
to do.
Exactly.
Is the best that you can.
Angela asks, can you talk about the effect of the mental health on students if exposures occur regularly, starting and stopping in school attendance? What about the fact that school will not look or feel like school? I know there's a lot of concern about that, the scariness of masks and things like that.
And there is, and those are very real concerns. I've talked to teachers about them. I've talked to parents about them. And I don't want to undermine or say that they're not there, because they are. But I think at the end of the day, when you talk about the risk of having no school at all, right? Because that's the other option. If we don't try, then we have no school at all. I think that risk is much greater. Mm-hmm. And when we're talking about reopening schools, it's not that anybody has ever said returning to school is 100% safe. It's risk-free. But nothing we do is. School was never risk-free. If we were talking about influenza, if we were talking about the school bus getting in an accident on the way to school, it was never risk-free, but it's about trying to balance those risks. And right now we have a risk of COVID, but we also have a risk of a lot of other things. Mm-hmm. And in terms of physical health, in terms of mental health, physical health outside of COVID. And it's really a matter of trying to balance those risks and trying to really put a little bit more investment in those other 2 categories in terms of kids' other physical health and their mental health, including their academics, in terms of getting back into school. Will it be perfect? No. Nobody's done this before. Mm-hmm. There's going to be things that work well. There's going to be things that work less well. We've had this at the hospital ongoing. There's things that we've done and seemingly changed decisions, but you do the best you can with the information that you have. And that's what schools are going to be doing. So is there a risk to kind of the back and forth? Sure. There's a risk to parents of that, right? Mm-hmm. The stress of, I'm going to go to work today. I'm not going to go to work tomorrow. But in the long haul and in the overall picture, I certainly think that keeping kids home from school because we don't want to try or because we're afraid of what might happen if they have to go back virtually, I think that keeping them home, indefinitely is going to be a much higher risk than at least trying to open the schools.
Right, exactly. And I guess I'll point out that made me think of I've been asked this question a couple of times. A lot of people that just kind of would rather this not be happening right now, or maybe don't think that it's the problem that it is. I have sort of said, well, but you said a number of months ago that we shouldn't wear masks. Now you're saying we should wear masks. How do we believe you? And my answer to that is, and I'm the first one to say, I sat here on a Facebook Live back in probably late March, late March, and I'm pretty sure I used the words, there's no need to wear a mask. Masks won't help you. I'm sure I said those words. And there's a reason for that. The reason is at the time we had no case reports of asymptomatic spread. Again, remember, at that time we were only at this for a couple of months with a novel, that's why we call it the novel coronavirus. It's novel, it's new, we've never seen this before. So at the time, there was no asymptomatic spread. So it didn't seem to make sense. So at the time we were basically saying, well, wear a mask if you have symptoms so that you don't cough on someone and give it to someone. But if you didn't have symptoms, don't wear a mask. Well, then it became more apparent as time went on that there was a fair amount of asymptomatic and pre-symptomatic spread. So you didn't know if someone in the community maybe had it and could give it to you. So that is a change. And that is as frustrating as it can be, and as much as sometimes it seems like we may not know what we're talking about, that's kind of how science works. I think it would be probably worse if we were to say, I said this back in March, I can't go back on my word, I'm not going to change it. We have new information that makes that no longer relevant or accurate. So that's why things change. And so to Dr. Fogarty's point about, there's going to be things that we learn as school opens, and it's not about why didn't you think of this, how could you have let this happen, or anything like that. It has more to do with, look, you do the best you can to think through these things with a novel virus. And you do the best you can. So, I guess that's my Let's see. There's a lot of questions that we won't be able to answer. There's, what about children who don't have computer access? Some of those questions we can't answer because that's not what we have knowledge of individual districts. Let's see, what are the options if school gets shut down and parents cannot stay home? It's a really good question. No way to solve that one here, unfortunately. I'm not trying to sound cavalier about that. It's a very important question, but I don't know that either of us have an answer to that, unfortunately.
Well, and that's something that we wrestle with, not just in terms of discussing reopening schools, but how do we keep the hospital open, right? So a lot of our employees have kids that go to school, and whatever latitude, vacation time parents had off was for the most part used up during the school shutdown in spring, and so that's why, again, it's extremely important for the students, for families, for the community to have in-person school open. Our community in particular, right? So if you look at all communities are very interrelated, but when you live in a place like Door County where it's a small community and we all rely on one another, it becomes very apparent very quickly how important it is that kids can be in a traditional school environment as much as possible.
Let's see. This kind of represents a lot of questions, or a handful of questions I've seen. Is there a recommendation when parents are high risk, or maybe a child lives with grandparents who are elderly? What are the recommendations there? And that, again, that's one of those questions that's not an easy one. I mean, that's where you may have to make a decision, and I'll certainly defer to Dr. Fogarty in a second, but you may need to make the decision. If the parent is at risk, maybe it makes sense for the child to do at-home learning. But those are tough questions to answer. Do you have any thoughts on that?
Well, I think that comes down to a very individual situation. So logistically, is it possible for that child to stay at home?
Mm-hmm.
We can't be having 6-year-olds that are learning on their own, right? I mean,
right.
So is it even logistically an option for that child to be at home? If it logistically is an option, how well did that child do during the school shutdown with online learning? Some kids were fairly successful at it. Some kids were not successful at all, either because the parent had difficulty conveying the information, there was resistance to doing it, there was a little bit lack of motivation because of the decreased accountability, and does that child have other benefits from school? So outside of academics, is that child receiving physical therapy, for example? That's obviously very difficult to do virtually. Does that child have an IEP or have additional assistance in other ways? Does that child need to eat at school? Mm-hmm. And so taking all of those things into consideration, so one household that has a grandparent that maybe is on active chemotherapy, so is significantly immune compromised, versus another family with a fairly similar circumstance may come to vastly different decisions for different reasons.
Yeah.
So it really is a weighing of those risks and benefits, and it's not just risk of COVID, it's risk of other things as well.
Yeah. Let's see, we're kind of winding down our time. I'm just looking to see if there are any burning questions that we haven't gotten to. And again, if I didn't get to your question, I apologize. It's not intentional. I'm just trying to. This is a really good one, and I'll see what Dr. Fogarty says. I got asked this earlier, I think earlier this week. Would you please offer your recommendations on boosting our immune systems heading into fall?
I think, in terms of the boosting the immune system, I think it's back to what doctors say about most things, right? So make sure that you're eating well, make sure that you're getting a good amount of sleep, make sure that you're taking care of yourself mentally, making sure we're getting good physical activity, and doing those things. I'll be interested to hear what you say. I'm not a purveyor of doing things like taking airborne or vitamin C or any of those types of big supplements. I think it's just doing the best you can to take care of yourself, both mentally and physically, is going to be the best thing that you're going to be able to do to get your body in the right spot to fight whatever virus it is or bacteria.
Yeah, and that basically was my answer too. Is and I made a joke. I did this in the lodge on the radio, and I sort of made a joke out of saying, you have to do the best you can for healthy living, things like that. And I said, and I say that as I reach over, this is what I'm drinking. So this is not exactly healthy. So I'm not going to be able to change my lot in life over the next month, let's say. But getting exercise, eating a reasonable diet, that's the best you can do. There really is, for all of the people that, what I get a kick out of, and this is my one little snide comment I guess I'll make, I get a kick out of for people that love to quote studies all of a sudden in this, that the studies that they don't quote or they don't believe, they don't choose to believe, are those that show that vitamin C, vitamin D, a lot of these things in large amounts do absolutely nothing. If your body doesn't need them, you will pee them out. And vitamin A actually can really cause harm. But so there really is nothing that says that taking those vitamins is helpful. I'm not against those. I mean, I think if that's what you want to do, that's fine. But I mean, there really is no evidence that says that helps. And so, doing your best to do a balanced diet. The other thing that I've talked about too is a lot of people, and maybe for kids this isn't so much, although these days I don't know. Yoga is really a great modality, because when we talk about stress in the immune system, there is something to be said about that. And yoga and those sorts of things are really helpful, especially for parents. If you, I've never found anything harder in my life than to get into a yoga pose, I must say. But it really is helpful because, we've all experienced in school, high school, college, wherever, we've had a big exam or something, and it seems like, at the very least, that we get ourselves all set for this exam, and the minute the exam is over, what happens? You get sick, or you get a cold or something, and it seems like your body's holding everything off until it's done, and the stress finally, so I think there is a role of stress in all of this. So that's going to be important. So I think with that, we're gonna call it a night. I just want to thank everyone for the thoughtful questions. It's really been helpful. It occurs to me, and I'm going to put Dr. Fogarty on the spot, it occurs to me that this might be helpful to repeat in a couple of weeks to see if there's any additional information that comes out. So we'll look to get that on the books. So I hope this has been helpful. Appreciate all the participation, and as always, thank you so much for joining me tonight.
Absolutely. I'm always happy to try and answer questions as best I can. These are big decisions that families and school districts are making, and we're going to do the best we can to try and keep everybody healthy.
Yeah, we'll get through it. All right. Thanks again, and be well.